The FBI stormed a mental health facility, discovering that patients' identities were systematically stolen and sold for profit. Behind locked doors, staff had turned vulnerable lives into a mechanism for fraud, exploiting trust and care for criminal gain. What appeared to be a place of healing had become a hub of deception. Patients who had come seeking help were instead trapped in a web of manipulation, their personal information harvested and weaponized. Families' trust was violated. Confidential medical records were transformed into currency for a criminal network. This was not a simple violation of law. It was a profound breach of ethics, trust, and humanity. A facility with a reputation. The Havenwood Mental Health Center sat quietly in a suburban neighborhood, its brick exterior, neatly trimmed hedges, and manicured lawns projecting an air of safety and professionalism. Families drove through its gates believing they were entrusting loved ones to a place of care, compassion, and medical expertise. Inside, doctors, therapists, and nurses moved methodically through corridors lined with patient rooms, counseling offices, and secure therapy spaces, performing their duties with the outward appearance of meticulous organization. Publicly, Havenwood cultivated a sterling reputation. It offered specialized programs for depression, anxiety, bipolar disorder, and severe psychiatric conditions. Investors highlighted its innovative treatment protocols, while local authorities praised the facility's low patient-to-staff ratios and rigorous adherence to clinical standards. Annual reports boasted high recovery rates and patient satisfaction scores, creating an image of a model institution, a place where vulnerable individuals could find help, understanding, and hope. School outreach programs, support group initiatives, and community seminars reinforced this perception, presenting Havenwood as an active, responsible participant in public mental health advocacy. Patients' families spoke of attentive care and compassionate staff. Media profiles painted the center as a beacon of hope, a sanctuary in an otherwise challenging mental health care landscape. Yet beneath the polished facade, an entirely different operation was in motion. Hidden behind layers of bureaucracy, patient records, and administrative processes, a network exploited the very individuals the facility was designed to protect. Documents were accessed for purposes far removed from therapy or treatment. Information meant to remain confidential became currency in a sophisticated criminal scheme. The contradiction between Havenwood's public image and the illicit activity within its walls would ultimately shock investigators, families, and the wider community. The first signs. The investigation began with a tip. A local bank flagged accounts opened using Havenwood patients' information. Fraudulent loans, credit cards, and government benefits were tied to names, social security numbers, and banking details stolen without consent. At first, it seemed isolated, but as reports piled in from multiple institutions, a pattern emerged. Patients, many vulnerable and cognitively impaired, were being systematically exploited. Whistleblowers stepped forward. One clerk noticed staff scanning files and sending data to unknown servers. Another reported suspicious deliveries, boxes labeled therapy materials, hiding digital devices and paperwork unrelated to care. The truth became undeniable. This was no clerical error. Patient identities were weaponized in a coordinated, large-scale fraud operation, hidden in plain sight behind a trusted mental health facility. Systematic exploitation. Havenwood's operations revealed an intricate system of abuse, exploiting multiple vulnerabilities simultaneously. Unaware patients, individuals with cognitive impairments, psychiatric conditions, or limited comprehension were easy targets. Consent forms were falsified or never obtained, leaving patients powerless. Internal complicity. Staff actively colluded to access records, alter files, and transmit sensitive information to external criminal actors. Paper trails. Billing statements, insurance claims, and administrative reports were meticulously manipulated to disguise the theft, presenting fraudulent activities as legitimate financial transactions. Digital channels. Electronic health records were extracted from secure databases, encrypted, and transferred to co-conspirators, creating an untraceable digital pipeline for stolen identities. By the time the FBI became involved, hundreds of patients had been compromised. Social security numbers, Bank account information, insurance documentation, and even personal histories had been funneled into a criminal enterprise that monetized the vulnerability of individuals for profit. The stolen identities were sold on the dark web, used to open fraudulent accounts, claim government benefits, and facilitate complex financial scams, all while patients remained unaware of the exploitation occurring behind the very doors meant to protect them. What initially appeared to be isolated errors or mismanagement revealed itself as a carefully orchestrated operation, leveraging trust, professional authority, and the invisibility of vulnerable patients to perpetuate crime on a massive scale. The whistleblowers. The case hinged on the courage of internal staff. One nurse, deeply troubled by the repeated misuse of patient files, secretly documented access logs, photographs of copied files, and unusual financial transactions. Another therapist provided testimony about patients being scheduled for administrative evaluations that were never medical in nature, sessions designed to extract personal information. These whistleblowers worked anonymously for months, fearing retaliation or legal consequences. Their records provided federal investigators with the detailed roadmap necessary to plan a raid and secure evidence. The criminal network. Further investigation revealed a sophisticated network. Staff at Havenwood acted as middlemen, collecting patient data. Third-party brokers coordinated the sale of identities to criminal organizations, including credit fraud rings and loan scam operations. Some identities were used to claim unemployment benefits and government stimulus funds, while others funded online scams. The scale was staggering. Investigators estimated the operation had defrauded millions of dollars over several years, all while patients remained unaware of their exploitation. Even more shocking, some patients were deliberately kept isolated or misled to prevent them from noticing the misuse of their personal information, ensuring that criminal activity could continue undetected. Planning the raid. The FBI raid required careful planning. Patient safety was paramount, as many residents had severe psychiatric conditions. Agents coordinated with medical staff, ethics consultants, and digital forensic teams. Surveillance and intelligence gathering took months. Investigators mapped all access points, server locations, and document storage. They worked to ensure the operation would reveal the full scope of criminal activity without causing harm to vulnerable individuals. When the day came, SWAT teams moved with precision, executing the raid efficiently and methodically. The raid. Agents entered the facility quietly, securing patient areas and locking down administrative offices. Inside, they uncovered secure rooms filled with copied patient records, computers containing encrypted spreadsheets with social security numbers, bank account information, and insurance data, external hard drives and USB devices holding thousands of scanned documents ready for transfer. Some patients were in therapy sessions, unaware of the criminal activity occurring around them. FBI agents coordinated with mental health professionals to immediately protect patients while collecting evidence. By the end of the operation, the scale of the identity theft was fully revealed. Hundreds of compromised individuals, thousands of financial transactions, and millions of dollars funneled through illicit channels. The human impact. The human cost of this operation was profound. Vulnerable patients suffered psychological trauma when they discovered their personal information had been stolen. Families faced financial loss and legal complications. Trust in the facility, and in mental health institutions broadly, was shattered. For many, the consequences extended beyond money. Patients questioned their own safety, their ability to trust caregivers, and even their own memories given the repeated manipulation and deception they had endured. The exploitation went far beyond fraud. It violated the dignity and autonomy of individuals least able to protect themselves. Internal complicity exposed. Investigators discovered that several senior staff members had orchestrated the operation. Administrators falsified records to conceal unauthorized data access. Therapists and nurses participated in schemes to obtain sensitive information under the guise of treatment. IT staff created secure, hidden networks to transmit patient data without leaving a trace. This network of complicity allowed the operation to continue undetected for years, highlighting serious gaps in oversight and accountability within private healthcare institutions. Legal and ethical violations. The operation violated multiple layers of law and ethics. Federal laws, identity theft, wire fraud, and conspiracy charges were applicable as patient information was systematically misappropriated. Medical ethics. The Belmont Report and HIPAA regulations were blatantly disregarded, violating patients' rights to privacy, autonomy, and informed consent. State laws. Unauthorized access to personal records and misrepresentation of care constituted criminal assault and civil liability. The ramifications were both immediate and far-reaching, forcing regulatory agencies to reevaluate oversight procedures for mental health facilities nationwide. The broader implications: the raid triggered reforms and policy reviews across the country. Federal agencies issued stricter guidelines for patient data handling, internal audits, and compliance reporting. Investigators emphasized the necessity of monitoring not just registered clinical trials or financial transactions, but also the administrative and operational practices of private health institutions. Yet the case revealed a difficult balance. Too much regulation risks impeding legitimate care, while too little allows exploitation to continue. Havenwood became a case study in how institutional trust can be weaponized against the most vulnerable. The broader lesson: ethical lapses in private healthcare are not abstract concerns. They carry real human consequences. The human cost. Patients' lives were irrevocably affected. Credit scores destroyed, loans defaulted, personal accounts frozen. Psychological trauma and loss of trust in caregivers. Families burdened with restoring stolen identities and mitigating long-term financial consequences. Some patients required ongoing therapy to address the compounded mental health issues caused by exploitation. The scandal revealed that human vulnerability can be a commodity, and that institutional failure can amplify harm in ways that extend far beyond monetary loss. Fall of Havenwood. After the investigation, Havenwood was permanently shut down. Senior staff members were arrested and indicted on multiple counts. Patient records were secured, and affected individuals were provided with support services and legal aid to restore stolen identities. The case sent shockwaves across healthcare and regulatory agencies, highlighting the need for continuous vigilance, transparency, and accountability. It was a stark reminder that even institutions dedicated to care can be corrupted when oversight fails and trust is exploited. This story is not just about identity theft. It is about human dignity, trust, and accountability. When vulnerable individuals are exploited behind closed doors, the consequences are devastating, lasting, and often invisible. If you believe institutions must be held accountable and vulnerable populations protected, if you want more stories exposing what happens behind closed doors in healthcare, finance, and other trusted systems, subscribe, stay informed, and share this story. Because the next scandal may already be happening, and someone needs to be watching.